Lockwood, and welcome to Pharmacy Technology and Management Ruse Direct Access Video Series. Today we hear from Mike Zandri, VP of Business Integration and Account Success at ProCare LTC Pharmacy, and Erin Mattingly, VP of Marketing at Clarest Health. Mike and Erin share with us the company's vision for the pharmacy of the future. This came about, as much does in long-term care pharmacy, where the company saw a need to serve patients wherever they may be. And with technology and adherence packaging, they also realized that they needed a new operational footprint to deliver the best level of care and retain talent, creative work environment that really encouraged employee retention and well-being. So to do this, they moved the front end and clinical work off-site and created a custom workflow in the fulfillment center using not only expertise from engineers, but also the expertise of their own staff. A really interesting story to hear how they've changed and increased their efficiency and how both employees and customers and patients have benefited. I'm so glad you're here today, Erin and Mike, and we'd love to hear about the pharmacy of the future. And Erin, why don't you set the stage for us, the Center of Excellence in Pharmacies of the Future, what that was.
Sure. Thanks for having us, Maggie. So several years ago, we started as ProCare LTC, primarily a long-term care pharmacy, and we recognized the need for holistic patient care, especially for that growing elderly population. So in 2021, we went through a rebrand, and that really represented us moving beyond that long-term care world to providing great pharmacy care beyond those four walls of a long-term care environment and really across the post-acute care continuum, so that we could serve patients where they were, multiple care settings for elderly and complex patients, because we recognized that there was really a gap there. Since then, we've brought in some strategic acquisitions, bringing the best in the industry of different areas together to realize that vision. And today our core service is our long-term care pharmacies. So you might know them as brand names ProCare LTC and or Remedy Senior Care. So what we really did is we looked at the journey of the patient with them at the center and looking at every touch point that patient has throughout that post-acute care journey. And we knew that optimizing each step of that journey was critical. So that being said, the LTC pharmacy being our beginning of our journey around that patient, we kind of gathered around Mike, who is also on the call today, and he developed what we call the pharmacy of the future, basically taking the best of the patient care, associate experience, and efficiency in mind, and creating a model for a long-term care pharmacy that kind of filled all of those needs.
Well, that's great. So you're kind of building on a model that you're taking all the pieces that work well and putting them together to optimize not just the pharmacist's experience with providing the care, but ultimately the outcomes for the patient in the various settings like you're talking about. Exactly.
Really scaling and bringing good pharmacy care to a patient, no matter where they are. Anytime in that patient journey that they are, whether it's transitions or a long-term care facility or in their home, being able to provide them consistent pharmacy care that really optimizes their medication throughout that and make sure they're on the right medication at the right time. Medication really can significantly impact their clinical outcome.
Mm-hmm. A good segue then. Mike, why don't you tell us a little bit about how this came about, the Centers of Excellence?
So when I started with ProCare 7 years ago, one of the conversations was, we're running out of space in one of our pharmacies. What can we do? And we kicked around a lot of ideas. Then in 2001, when Hamad came in as CEO, he brought a new vision to all of us. And it was take care of the patients from birth to death. And I'm simplifying. I'm using my words. I'm not quoting any
Sure.
policies or anything, right? And so because over the years we've serviced group homes, children's centers, jails, assisted living, nursing homes, rehab facilities, we can indeed service all those levels and age groups, primarily, like Erin said, long-term care nursing home is our core business, but there's no reason with the packaging technologies that we have and a footprint that we can create with a more efficient pharmacy, we can't expand into that. And one thing that I found very interesting that Ahmad brought to us one night over dinner in Long Island, he said, "What about when the patients go home? They go home, they get a pile of prescriptions. The person that is picking them up, if they don't have any healthcare knowledge or experience, they don't know what to do. They just want to get the person home from rehab, and then they have to run out. It could be 10 o'clock at night and get their prescriptions filled. And if it was rehab for a new hip or a new knee or a new shoulder, they're going to be in some pain. You need to make them comfortable. You need to be comfortable in order to heal properly." And so he started talking about, well, what if we could discharge patients with the medications that they were taking in a nursing home when they were there for the rehab stay? Now they wouldn't have to worry about 10 or 12 old vials that they had before they went into the nursing home. They would have everything that the doctor wanted them discharged on when they leave. And with Erin's help and Tom and Paul and Hamad, we started looking at alternate packaging, and we came up with compliance packaging. Compliance packaging isn't new. It's been out there for many years. But it becomes, unless it comes with a service, it's a commodity. Drugs are a commodity unless they come with a service. And we don't want to be in a commodity business.
That you point that out, though, this idea of service, because that's really what you're talking about in the new vision is providing services, right? So that's a very good distinction to start with right there.
To any age and any level of care.
Mm-hmm.
So let me give you an example. My mother-in-law lives independent living, a couple miles from the house. She doesn't need to be there. She just doesn't want to cook and clean for herself. So every 2 weeks, Maria, my wife, goes over there and fills her little pill boxes with all her medications. So, and that's great because Maria does that for her mom. But wouldn't it be great if we could just send her every 2 weeks a strip package, have it delivered right to the independent living, and you open up the container and you see Monday, 8 a.m. and the drugs are all in one nice neat little packet, easy to tear open, pour them in your hand, take your pills. You don't have to do anything. And perchance, one of her medications gets switched to midday. Well, with the packet, you have a midday packet. Whereas now she only has morning and night little bubbles in her little pill box.
Mm-hmm.
So,
and I think it's important, Mike, to say the kind of the reasoning for the pharmacy of the future coming about was that kind of technology and that kind of thought process of being able to bring that technology to our communities that we serve really required a different operational footprint within that long-term care pharmacy, which is how Mike looked at it whenever he was coming up with the floor plan, because it's unique.
Right.
He thought through each operational step of it, including that piece of adding in the technology that is going to make it easier, faster, better for our residents and their clients and our patients.
So Hamad brought in 2 Lean Six Sigma industrial engineers. One happened to be a pharmacist who moved to the industry side, and the other was a packaging engineer who had worked in big industry for years. And they said, well, what do you envision? And I said, well, you need smooth workflow. You can't have spider web steps. Think of a spider web, right? You need it either needs to be linear or it needs to be horseshoe. So unless you have a building that's 50 feet wide and 400 feet long, That's not going to work, right? So you're looking for a square footprint where you can have the deliveries, your incoming drugs come in one door, go through the entire process, be packaged, be checked, be scanned into the totes, be passed off to the drivers, and go out a completely different door, a horseshoe. So when we started to design the new pharmacy in New York, we created a horseshoe model. Now let me stop there for a second. In the meantime, we were deep in the middle of COVID, and it occurred to us that because of COVID and social distancing, we started having our front end people. So our order entry people and our electronic prescription processing people, and even the pharmacists that reviewed all that work, did not need to be in the pharmacy where fulfillment was done. They could be anywhere. So as we started moving people out, and with COVID and people being sick and not as many workers out there, and the nursing homes not having enough staff because, again, of sickness and people just saying, I don't want to do this anymore. Hamad came up with the idea, well, what if we built a clinical hub in an area where it's easy to hire people that can do these functions? The architect said, well, wait a minute, if I can pluck out front end, I can use more of that room for fulfillment. So we again stopped, redesigned a good portion of the pharmacy. And then as we were in this design, we realized that if we were going to be able to do what we call compliance packaging or strip packaging, it's called many things, we could bring in that technology and we could work it into our horseshoe design, and we would not lose any workflow, especially now that we just have all the extra space by moving the front end out. So Hamad was really the visionary and came up with the ideas and then said, okay, take a stab at it, Mike.
And then where did the front end people go? Where does that staff go? Or
a lot of those people were already working from home.
So last year we opened the clinical hub in Phoenix, Arizona. And there was a lot of thought put into the placement of that clinical hub. And primarily it came from having a concentrated area of qualified professionals that could work that front end for us.
Mm-hmm.
And so the concept is we have that 120 workstations in that clinical hub to work all of our front end for our pharmacies. And it really allows us to leverage talent across different pharmacy locations. So whereas if I was in the clinical hub and I was an expert on one piece of the front end, I was pretty siloed to that one pharmacy. With the clinical hub, we're able to leverage that expertise across multiple locations. And that allows us to really leverage that kind of center of excellence concept, and that we're taking the best of and really applying it to all of our pharmacy locations. So that's the center of excellence concept. And then to Mike's point, the fulfillment centers truly became the center of excellence for fulfillment because of his design.
Mm-hmm. Mm-hmm.
We have server farms on the East Coast and the West Coast.
Mm-hmm.
And Hamad was adamant that we had to have that redundancy.
Talk a little bit more about the input that the pharmacist and pharmacy techs had on the design process. So really talking about, we didn't design this blindly, and it wasn't done by just an architect. It was a group of pharmacists and pharmacy experts that kind of came together to say, what does this look like in the best way possible?
Put your own design into it. What we brought to the table with the architectural drawings and the floor plan and the workflow was the concept of horseshoe and zones, and the pharmacists and the lead technicians, they understood all that. But then they came to us and they said, well, where is this going to go? Where's that going to go? Where's this going to go? It's like, well, now this is where you're getting a house with bedrooms and bathrooms and living areas and everything's painted white. This is where you add the color. you make it work for what you have, right? Because I'm not going to put tape on a counter and say, this is where the computer screen goes and this is where the printer goes, because I'm right-handed. Someone else might be left-handed. So there was flexibility within the global design to individualize it by pharmacy.
Oh, wow.
So we know, because we have instant access to all the prescriptions that we filled on any given day or in a 90-day period. So we can run reports and look and see, well, this pharmacy does a higher percentage of non-oral medications, oral solids, than this pharmacy. So they might, right now, they might need an area that's a little bit bigger. And all the drug racks and the delivery racks, they're all on wheels. They're all rolling racks. So as things change, it's very, very easy to just move a rack here or there. And then the other thing that we didn't touch on, which is very important, and again, we didn't create this, it's called bin locators. So think of, I'll just use 3 drugs: hydralazine, hydroxyzine hydrochloride, hydroxyzine pamoate, and hydrochlorothiazide. So a new technician is going to look at a label and be like, what? Right? But if you have the drugs on the shelves by bin locator, they know they can go to bin A100, bin A132, and bin B17, right? It's easy. There's no duplicates. They don't have to look at the first 7 letters to figure out what the drug is. And the beautiful thing about it is, if in each section you leave a little bit of empty space, when a new drug comes, you assign it a bin number, and that's where it is. So when they get their labels, their labels are printing based on where the bins are anyway, but they get their labels and they're like, oh, I never heard of this drug. Oh, but I see this is B217. And they just go to that bin, grab the drug. It's like, oh, hey, I've got it now. And again, a lot of those sections were designed by the pharmacy directors. They said, well, I think I want to do it a little different. I want to do this. I want to do this. This is your square footage. This is what you have to work with. You have rolling racks. You can put it where you want.
Right.
And they work to their employees' efficiencies.
Right. And it also takes out the human error of misreading a label, because you're just reading a bin number and then.
Well, to put it into perspective, and some drugs have more than one label, right? You know, if you have 2 blister cards of 30, well, you'll have 2 labels. But Syracuse on any given month is printing 130,000 labels.
Right. Right. Which is pretty amazing.
And it's going to increase by 15%, or it has increased by 15% in the last 2 weeks.
Mm-hmm. Give me kind of what the workflow is like as far as, communicating with the front end hub and then with your facilities. I guess give me a little bit more about how that looks.
So the reason it's so effective is, as Erin pointed out, if everyone worked for one pharmacy, and let's say one pharmacy has 5 front end people and one person is sick, they just lost 20% of their workforce for the day. But if you have 50 front end people and you lose one person, you lost 2% of your workflow. It's easy for 49 people to cover 2% of the work than it is for 4 people to make up for that other 20%. Mm-hmm. So essentially, we have people in the clinical hub that are cross-trained over multiple locations. In states where you have to have certain licensure, they're licensed across multiple locations. And they can do multiple of the front end tasks. What we realized during COVID is, even though we felt that we were very employee centric, we needed to be not just good but great. And so what we built into all the new pharmacies were more comfortable break rooms. We put in call rooms, so if one of the employees was on their 10-minute break and they needed to make a phone call in private, they could go into a room that was insulated where people couldn't hear them outside of it. They could call their doctor, they could call their mom's doctor. We also put in a room if you weren't feeling well. And within that room, we had a couple comfortable chairs, a little round table. We had a refrigerator, and it really doubles as a nursing mother's room, where we found that becoming more employee centric or being great at it, that employees were less likely to say, well, I'm just going to go over to Joe's pharmacy because I can make 12 cents more an hour.
Right.
The other thing is we modernized the break rooms. Erin designed a beautiful break room in the pharmacy in New York. We have multiple refrigerators for the employees. We have an 80-inch TV that they can run news or sports or whatever in the background. We have seating for 30 people in that pharmacy. Syracuse is a little bit smaller. We have seating for 20 people. We have vending machines for drinks and sandwiches and multiple microwaves and toaster ovens, so people can bring their lunch, do whatever they want, and they really enjoy it.
I mean, it must have a positive impact on day-to-day operations.
What school of thought you're running with 90 days, we put in more bathrooms than we legally needed. So in New York, we have bathrooms that are accessible to the floor, the main floor, and then we have bathrooms that are accessible because we still have offices and the break room and the nursing room and the call rooms. They're away from the fulfillment area. They're in another part of the building. There's bathrooms there too. And someone said to me, well, why do you need bathrooms there too? The majority of the people are working out in the back. I said, because when they come in for their lunch, they punch out, they go wash their hands, or they go to the bathroom, and then they go and have their lunch. And depending on when they go back, there's a bathroom in the back, there's a bathroom in the front. The other thing that we did in both pharmacies is we put in a driver's bathroom. So anyone that is delivering to the pharmacy or making our deliveries, they have their own restroom. And you say, well, why do they need that? Well, you can't have them coming into the pharmacy. They leave, right? They leave to do the deliveries, and they're like, oh, I need a restroom. Well, now they know we've got a bathroom for them. As a manager, I have two sets of customers. I have internal customers and external customers. My internal customers take care of my external customers. If you're happier at work, and that goes for drivers too.
Well, that's what made me think of it, is talking about the drivers. Yeah.
Right? They're trying to make the deliveries as fast as they can because they want to get home when they're supposed to be home. And being that they have a restroom facility before they leave the pharmacy, if they need to use it, then they're not standing there kind of, bouncing around trying to rush the nurse, hurry up, I gotta go to the bathroom. We've just taken that right out. And so by treating everyone the way they want to be treated, as my grandmother would say, we have happier people. And happier people are more fun to be around.
True.
Just throwing it out there. So Hamad really wanted us to focus on the internal customer because ultimately they take care of the external customer.
And tell me a little bit about the workflow with the horseshoe shape, and tell me what the feedback has been like for that. Was there any training you had to do? And I guess I want to hear a little bit about the technology also, as far as tying together in the fulfillment versus the clinical hub, how you if you employed any new workflows that way, or any new tools to make that more make that
so what we did with the when the floor plan was finalized, we did a test fit, and then from there all the architectural drawings were done. But we took the test fit, we blew it up on 3x4 paper, and we posted it up in the break room of the old pharmacy, so all the employees could look at it. And we put some notes on it. And then as the pharmacy was being built, we took pictures, and underneath the picture, we wrote what it was, where it was, and kind of moved it around. So the employees, as it was being built, even though they hadn't been there, they saw the floor plan, they knew where their workstation was going to be based on what they did in the pharmacy. But essentially, drugs come in one door, from the wholesaler. They get delivered. First place they go is to the receiver. Then from the receiver, they get checked in, and then they get put into stock. The other thing is when drivers have returns, they bring them when they're picking up to deliver, they come in one door. But when they're bringing returns back from the nursing homes, they go in the door of where our deliveries actually come into when are receiving. Well, so it goes through the receiving area, then it goes to the returns area, and the drugs there get processed. And then even though we have robotics that package quite a few drugs for us, we still pre-pack medications in blister cards. And so as the new drugs are coming in, we know the floor manager knows exactly what he or she needs to be pre-packed that's not in a robot. And some things aren't in a robot just because they just can't be in a robot, right? So they get pre-packed right away before they go out into the floor. And then from there, you have your zones. You'll have a refrigerator zone, and because there's a lot of refrigerator items, it might be broken up into an A and a B. Insulin and a non-insulin refrigerator section. And then you have your eye drops, ear drops, you have liquids, you have topicals, you have inhalers. So what you have is the non-oral solids sections. And I call those pick and sticks, where you grab it and you stick the label on. I mean, there's more to it than that, but
Sure.
essentially pick and stick. So the labels for all those different zones can print. So the person working in that section, it's really set up so he or she doesn't have to take a huge amount of steps. Their labels will print right where they are. They have a computer, so everything they do, they scan. Everything gets scanned throughout the whole process, and they can turn around and take one or two steps and grab what they need, and it's right there.
Mhm.
And then it's set up where they can either bring it over to the checking area, or we'll have a runner that'll come by and pick it all up and bring it over to the pharmacist checking area. Now we're getting closer to the other end. And then once the pharmacist checks it, it gets pre-sorted, and then it gets scanned into the delivery totes. It's pre-sorted by facility or delivery route, depending on how that particular manager wants it. And then it gets scanned into either the delivery tote or the delivery bag. Now, prior to the pharmacy of the future, we'd have the bags all stacked up, and drivers would come in, and it would be chaos. And it would take sometimes an hour and a half from the time we actually put it in the bag until the drivers were on their way.
Oh,
So
wow.
what we did is we put up shelving, two-sided shelving, and think of a jack-o'-lantern teeth, right? You know how you carve them out. And so we put the shelves like that because you need a long area. So, but by making for the number of homes that we have, so by making the jack-o'-lantern teeth with our shelves, the drugs go. You get more linear feet, and then the drugs go on a shelf. Once those bags are sealed or totes are sealed, the delivery guys come in from the other side, grab their totes or their bags, and then we have workstation tables where they can actually sort their bags. And prior to the pharmacy of the future, they grab all their bags, they go out to their car, turn the light on in the car and try to put everything in order. Now everything is in order before they get in the car. So we're saving in at least an hour a day in getting the drivers out the door with this system.
I think the last question was sort of the key takeaways, which I feel like we've touched upon, but I don't know, what do you feel would be, after doing this experience, I guess, what are you most proud of, or what do you think is really the biggest game changer, so to speak?
Well, I think that the additional technology that we have, so we have multiple dispensing systems, and so we can offer a nursing home one of multiple dispensing systems, and each dispensing system is set up in a way in the pharmacy where people aren't walking over one another to get to what they need. Everything flows from when it's received into the pharmacy and processed and packaged, it just flows right through the horseshoe.
What's been the increase, or how have you seen your volume increase because of this? Obviously, the whole point is to be able to scale up and still provide high quality care. And what have you seen so far?
Well, in the two pharmacies, the most recent pharmacy moves, we were at a point where we couldn't take on any more business. And now with the efficiencies that we've picked up and the extra space, we've just added in one of the pharmacies 15%. We grew 15% just because we can now take this business on. And then the other thing is our footprint can be larger. And that's tied into multiple things. One being automated dispensing systems and emergency kits, but it's all electronic now. But the other thing is the drivers can go further because they're not spending as much time from the time we bag it or tote it to get to the facility. So they can make multiple stops.
Mm-hmm.
Otherwise, if they're losing an hour on the front end, it pushes everything back. And the nursing homes and the adult homes, everyone, all the customers, they want consistency when their drugs are being delivered.
Right.
They understand hurricanes, tornadoes, blizzards, right? Road closures, they get that. And we let them know, hey, we've been tracking the weather, but next Tuesday it's going to be bad, and we may have to change things. We'll keep you in the loop.
I really enjoyed learning about this. It's so interesting. I didn't quite understand it when we first talked about Erin, but now I have a much better understanding and feeling for how different this really is and how much it can allow long-term care pharmacy to grow and meet the different settings that long-term care pharmacy is going to be serving in the future. So it truly is, a new way of looking at providing pharmacy care.